Before I came to the Congress, I ran a consulting firm focused on system integration and lean operations, in effect helping companies maximize effectiveness by minimizing complexity. In the private sector, a well-run business will coordinate information and resources between its operating divisions, and saving a lot of money in the process and reducing overhead, being much more agile and being able to respond to customers. Unfortunately, many of our human services programs don't operate this way. I chair the Human Resources Subcommittee and deal with this on a weekly basis here in the Congress. And inside HHS, there are many legacy systems and processes that are siloed, many of which were actually put in place when you and I were children. As you know, the House has moved several bipartisan efforts to standardize the exchange of data and reporting in human service programs. The most recent example was in the recent Middle Class Tax Relief and Job Creation Act. We have referred to a provision inside of that as data standardization, and the chairman worked very hard to make sure that that got all the way through the conference committee. My view is that you can't fix what you can't measure, and data standardization will make reported and collected data more interactive and useful to better measure our outcomes and proactively identify problems and improve the effective use of taxpayer dollars. Our overarching long-term goal is to improve the efficiency and coordination of these programs in order to help more families become self-sufficient. And I think there's some common ground here. What I'm interested in hearing your thoughts on, or I'd like to hear your thoughts on data standardization in general, but several questions, or a question with several parts. First, do you agree that human service programs are siloed and could operate in a more efficient manner? Secondly, do you think that this data standardization provision will be helpful in better coordinating programs and services, and in fact should be expanded into other parts of your jurisdiction? And third, what more can Congress do to help your department bring these programs into the 21st century? And I'm focused very much on the processes. There will always be ideological or policy issues where we may disagree, but from a fundamental business perspective, I'd like to hear your views on this.
Well, Mr. Davis, my understanding is from our staff that this effort on data standardization was not only enormously productive and found a lot of common ground, but we are eager to continue to work with you and others on identifying other areas. I don't think there's any question that government programs are often siloed. We have done an effort across the Department of Health and Human Services to look at redundancies, try and eliminate areas where we're repeating mechanisms. We've gone to a data sharing platform in many systems where people are not any longer building new data systems to support some unique program, but looking at ways to share that. But we would be eager to find additional strategies, sometimes new eyes, and looks at budgets, reveal things that people haven't seen from the outset. And I'm a huge believer in the more efficiently we can operate any of our programs, the more strategies we can implement that not only have been in place in the private sector 10 years ago, but some of them 50 years ago are all good news. And so I would look forward to that. And again, I think the project that you mentioned, my understanding is off to a good start, but we would love to find additional ways to continue that.